Okay, this is Cassandra, and what we're going to talk about on this portion of the chiropractic approach to is sciatica. Now, there's a lot of different reasons people get sciatica, okay, but as the chiropractic approaches, we want to look at the patient three-dimensionally. Okay, a lot of chiropractors don't get terrific success with sciatica a lot of times because they miss certain dimensions. Okay, and what I'm talking about is, I'm just going to step in front of you. When your pelvis can shift back and forth, you can have twists, you can have a whole bunch of things. So we're going to kind of show you how we worked with Cassandra. Cassandra, why don't you tell them a little bit about kind of what was going on with you and you know, how long you've had this and so on.
Yeah, I've been dealing with sciatica for almost half of my life.
And how old are you? You don't look that old.
36.
36.
And,
so over 15 years.
Yeah, over 15 years.
Okay.
It was due to an accident I had when I was a teenager, and it all started with my lower back, and there was a lot of pain in my lower back, and I didn't know exactly what to do about it. So I went to a surgeon, and he recommended surgery, of course, and it just scared me because I was, you know, so young, and I didn't really know what other options I had, and I couldn't walk very well. I was always in pain. I was always in pain. So I was taking a lot of ibuprofen and Tylenol and just doing whatever I could to ease the pain. And my first adjustment with Dr. Nikitow, it was just amazing. I walked out of here a new person. And it's just amazing because the pain level I'm going through is not even close to what I was going through on a daily basis.
So let me just ask you a question. You had sciatica for 15 years.
Yeah.
Okay, and you didn't get the surgery. You just lived with it.
No, I just lived with it.
You just lived with it.
Because it scared me to go
Yeah.
through surgery.
Now, did you have sciatica on one leg more than the other, or was it kind of both legs and it kind of alternated, or what?
Yes, it alternated between right and left, but mostly on the left.
Okay, okay. And at a pain scale of, if 10 is excruciating and 0 is nothing, where were you living your life? What pain number was that?
It was over 10 easy.
Over 10. So
Over
we're
10.
at 10 out of 10, here's a lady living for 15 years. Okay, now, I don't understand why doctors don't refer to chiropractors for this, because after the first adjustment, you were just here the other day, and hence is why we're doing this,
Yeah,
your sciatica was gone after the first adjustment.
yeah.
Now, 15 years, a level 10 pain, going after the first adjustment. Let me explain what we do. Now, as chiropractors, we're not working on back pain. I'm not even working on her sciatica. She has sciatica. I'm working on a human being that has sciatica. What we're actually working on is the alignment of the bones for nerve integrity. See, chiropractors don't move bones. What we do is trigger nerves to tell muscles how to pull bones. So it's very important you understand it, because when I show you the dynamic of what she has, I've seen patients that have gone to the chiropractors and they do all these types of treatments, and people think chiropractors are all the same. They're not. We do a three-dimensional program using a Cartesian coordinate system, X, Y, and Z axis, like they track satellites. This is more precise for helping us know exactly where the problem's coming from, so we can zero in exactly on that problem. So it's not just rolling around a table and doing manipulation, maybe like an osteopath or doing physical therapy. We're actually zeroing in on finding what is wrong, where the misalignment or what we call subluxation is, where the compression on the nerve is. Because if that goes like that for a long period of time, you're going to get a lot of wear and tear and degeneration, just like a wheel out of alignment in a car. And didn't we see some of that with you?
Yes.
So after the first adjustment, absolutely no sciatica. We can't take away the degeneration or arthritis, but we can stabilize this pattern. Now let me show you what I did with her, kind of what you need to be asking your chiropractor to do. And if you're a chiropractor, these are some of the things that we teach in our courses, so you can learn to do this specific type of program to fix somebody and help them. Now it's going to take a while for us to actually align the spine, because we're not treating the symptom. Otherwise I would have released her after one adjustment. But we have to see pre and post x-ray showing that the spine has been fixed and changed, so we know it's stable. Then we can start maintaining the spine thereafter. So just let your arms hang down and look straight ahead. And what we want to do in our three-dimensional system is we're going to look at, first of all, this area right here. Okay, now when we look at this area, what we're looking for is we're looking to see how it lines up with the chin, and that's pretty good. She's maybe a little bit this way. When we come down to the belly button, and we're looking down here where we see the line, a line that would, imaginary line that would draw down to the belly button, okay, we can see that her belly button is way over on this side over here. Okay, so what that means is that her pelvis, and let me just step in front of you for a moment, her pelvis is shifted this way. This is called translation. Now, if you have a translation, you better get ready to warm up for surgery, for a hip surgery, because what's going to happen is you're carrying more weight on one side. And in Cassandra's position, since her pelvis is shifted this way, her lower area here is now translated with the top. If you look at this as section 1, section 2, section 3, or boxes, how they relate to one another is very important because you can have multiple distortions, okay? Now, she has this distortion, so now she's carrying all this weight on the joints of the left side. She's compressing down on the hip. And let me ask you a question. Didn't you feel pain in your hip joint as well?
Yeah.
Yeah, because all the weight down here, the majority of our weight is carried from the head down to the waist, and so it's carried all in this hip joint. If this translation isn't fixed, okay, which a lot of chiropractors don't adjust for this, and I'll show you how we do it, this hip is gone because it's going to wear out just like a wheel out of alignment in a car. Now, secondly, turn to the sides for just a moment. The other thing we'll check for is we're going to check her front here for rotation. Now, when I put my hand here and I put my hand here, okay, this hand is way, way forward compared to this hand over here. So when I touch her hip, instead of having it lined up like this, it's lined up like this. Now you can do this yourself if you want to check yourself. You just kind of step in place for a few minutes and then just stand and look in the mirror. You can look at your belly button as to how it's lining up here. If your belly button's like way over, that means translation. Take your hands and touch the little finger so they're flat to the front here of your pelvis. Okay, and if you touch your own pelvis, your fingers should line up. In other words, your fingers should line up this way. If one of the hands is more forward than the other, you have rotation. Now, rotation is where your hip is twisted this way, and this is what Cassandra has. She has a translation and a rotation. Those two elements are often left uncorrected in most chiropractors' offices unless they do this three-dimensional correction system, which I teach. So basically, as we look at her, this pelvis is coming forward. This one's going backward, okay? So she's shifted this way, she's twisted this way, and a twisting of that magnitude will be like doing an Indian burn on your wrist where it's going to just torsion that disc that's in there, okay? Now lastly, turn to the side. If you look at her from the side, okay, you're going to see that she's kind of rounded in her shoulders, but she has forward head posture. This is the center for posture. If you'll see it should line up with her ear right here, and she's kind of forward. Now, how does this affect the lower back? What happens is when you have forward head this way, two compensations occur. Your body senses that it's falling, so what it does, the pelvis shifts forward. So now a patient goes like this, and as they age, they accordion down. Now, when a patient's hips go like this, now they're carrying all the weight on the joints. So as you stand, you feel like you always got to stretch out like this and bend over to go, oh, my back is killing me. Is that something that was pretty consistent with you?
Yeah.
Okay. Now, on her x-ray, what we discovered is that the bone, because of that, turn to the side here, because as her head is forward, her hips move forward, the bone, the last bone, actually fell on the sacrum. The sacrum is the triangle bone between the hip. Her bone, her fifth lumbar, fell forward. That's called spondylolisthesis. Now, that big word means that bone is actually fallen forward. So we have a special adjustment for spondylolisthesis that a lot of chiropractors don't know, and I'm going to show that to you today. Because this is the type of thing, if you have a symptom where you feel like you got to go like this all the time, but if you go to bend over to touch your toes, you feel like you got to wiggle like this, in other words, you can't just bend straight over, that's an indicator that vertebrae is way too far forward, and there's a real specific adjustment that needs to be done. It can't just be done by rolling you on your side like a lot of chiropractors do. So this is a great one for you chiropractors to learn how to do, and patients, if you have these types of issues, these are the things that I want you to ask your chiropractor about. And they could call our office. We have programs to teach them and do all these kind of things that will help them. Let's get your face down on the table real quick, and let me show them exactly what I do with you in terms of correcting this for the sciatica. Now the first thing I'm doing here is I'm checking her leg length. Now this leg is about a ½ inch, almost 3/4 of an inch shorter, okay, than the other. Okay, so if I look at this area here, I'm looking at that, okay, to see. I'll check her knees. This knee is rotated. So I'm going to pull your shoes off, dear, okay? And we're going to take a look over here also at your ankles and stuff, okay? Now, one thing you always want to check is you always want to check the ankles, you want to check the knees, as well as the hip, because a lot of chiropractors don't look at the feet. In Cassandra's case, she's got some pronation where her feet are actually rolled this way. So as the feet pronate like this, okay, the knees, the weight-bearing line gets thrown off, and then the body flares. Now, if you have a pronation of one foot more than the other, like this, watch what happens to my hip when I pronate just my right foot. It rolls my hip forward, so now I have a rotation. If you have that, you need to have an orthotic. And I'm not talking about going to the foot store and getting an arch support. I'm talking about an actual orthotic that we computerize and measure the measurements of the spine so we can actually get this thing fixed. Otherwise, that rotation stays. Now, as a result of that, her main problem is on this side. Her heel is rolling in this direction. It's supinating. It's twisted this way. Okay, so we can see that here. Okay, this one is relatively straight, but when we look at this one, it's rolled in this way. Okay. Okay, now when we look at her heels, we can see the left heel is rolled inward. Okay, is where this heel is actually, it's turned inward like this. Okay, that's causing this portion of the knee, okay, to actually make a shift, so it's actually twisted in this direction. Okay, so what we're going to do here is I'm going to actually adjust her ankle first, and then I'm going to adjust her fibula, because it's rotating and twisting, is causing this to turn inward, okay? So what we'll do is we'll actually check in the foot, and a lot of times you'll see patients that have what's called a drop metatarsal here. So we'll actually, this arch here has to curve like this. Hers is flat. This one has to curve like this, and hers is flat. So we'll come up here, we'll adjust straight down in this direction, like that. We'll come into the metatarsals and adjust up here, like this, and then lastly we'll take the heel, just relax your leg here, and adjust it over to that side, okay? Now, when I adjust the knee, what I'm going to do is I'm going to contact this knee, because, see, the ankle bone is made up of the same bones that make up the knee. So if your ankle's off, you better be checking the knee. A patient could complain of knee pain, but you have to adjust the ankle. They can complain of ankle pain, they could need to adjust the knee, and both of those will affect how the hip position is. So now we're going to come in here, and I'm just going to give a quick tug. Okay, good. And that's lined up good. Super. Now we see that this is perfectly straight. And if you look down at the heels, this one is perfectly straight like this one. Okay? Okay, so let me now show you what I do for the pelvis and how we got rid of her sciatic pain within one adjustment. And this is not uncommon. But again, you don't want to be working with a chiropractor who just works on pain. Otherwise, the pain goes away here, but they've still got this much of correction to do so it's stable. So you have to have x-rays to show before and after to show the differences in how the spine is actually shifting. So we're going to start up here at the neck because she had the forward head. So one of the things we'll do is we're going to raise this section up here a little bit. Okay, get the head back, and then we're going to adjust here like this. Okay, and then we'll just straight down this way like that. Okay. Turn your head, look over here, let it drop, good. Turn it here, back to the center. Now we're going to work on the neck curve, because her neck was actually going in the wrong direction. Okay, the normal neck should go like this, her neck was actually going like this. So that's called kyphosis. That puts a huge amount of tension on your spinal cord. Now keep in mind, if your neck and your low back have the same curve, if your neck is going like this, your low back is going to also be shifting forward like we talked about. So we have to move forward this way. So your chiropractor needs to be adjusting forward into the neck. Not just taking rotations out of the neck, but actually moving forward just like we do here. As that neck goes forward and curves better, so will the lower back. Okay? Now we're going to come down here into the lower back. We're going to stretch the sacrum, which is the last bone, so it comes down. Okay, that's number one in fixing and helping the spondylolisthesis. Now we're going to fix those translations and rotations. Okay, first of all, you can see how her sacrum is way up over here, so it's tilted. That's because her hip is rotated, okay? So you can adjust the sacrum, like which we'll do here. Okay, and this is a drop table, and you'll see that sacrum come more even. But the sacrum will go off again if you don't take the rotation out, because she's developed what's called nerve muscle memory. As she gets stressed, as she walks or everyday stresses, the body fires a nerve impulse to the old habit pattern. So that's important to know. So now we're going to move the hip over here, because remember, she was translated over to, or rather to the other side. She was translated, yeah. So we're going to move it this direction. So now what we're doing is we're taking the hip and we're putting it opposite position of where it was before. Because remember, her hips were too far over this way compared to here. Now what we're doing is we're moving the hips in the opposite position to the torso. And now we're going to trigger these nerve beds. Okay, these are triggering beds that will stimulate nerve impulses to these muscles to actually tell it to move over. So we're going to use the drop section. And we're going to fire about 5 times. Now move over to the center. Now doctors, if you don't have a drop table, just pump the area, because that's going to trigger that nerve bed to fire that off. That's what we call proprioceptive mechanism, okay? So now we've taken care of the translation. Now we're going to take care of the rotation. Lay on your side. Now in the rotation, we're going to keep the legs a little more straight. Okay, now move your butt back on the table this way. Keep the legs straight here, this one straight, and roll it forward. Now you'll notice I've got the legs straight. A lot of times when chiropractors adjust, they adjust with this knee bent. Well, the reason they're doing that is because they're taking a torque out of the hip. Okay? In this case, we're not taking the torque, but we're taking the rotation, which is on what we call the y-axis. So we're going to actually take this and rotate this way and unwind that dish rag effect that we were talking about. So we're going to take the pelvis, just roll it, and that's how we fix it. Now, lay on your back. Now the last portion of this, scooch up like we did before. Now what we're going to do is to take that 5th lumbar that's too far forward, we're going to actually drop it this way, okay? And this is part of why she felt so much better after the first adjustment. What we're going to do is lift this section, scoot up a little higher. Okay. Okay, now what we're going to do is we're going to, we'll bring her knees up like this. Okay, now where we've got her here is at the top of the sacrum. So, in other words, here's the sacrum here, here's the 5th lumbar. What I've done is I've put the table here and I've lifted it, okay? So now what I'm going to do is lift her knees, I'm going to cock the table, and I'm going to adjust straight down. That now has taken the lumbar, so because I've got the table here, and I'm pushing this up, so the only place for the lumbar to go is down. So when I make that adjustment, it falls. Unbelievable adjustment. That's going to free so much pain because it's going to take the pinching from the joints and open it. Okay? How'd that feel? That felt good?
Yes.
Okay. So then we'll finish adjusting her neck, atlas, axis. Now sit up. And then we're going to do her 5th lumbar. Scoot forward. Just lay back, and we're going to adjust here. Up you go. Okay. How'd that feel?
Awesome.
Okay, take a walk around the table because we want to just show them one more thing. Okay, so how do you feel after that?
I feel great.
Okay. So what I want to share with you is this, okay? Now, she just took a walk around the table. After you adjust a patient, you want to have them walk because we're dealing with a system called proprioception. We're firing nerve receptors in opposite positions so we can change what's called her nerve muscle memory. Her abnormal pattern, as she's had for 15 years, has now become her normal. So we have to do a lot of adjustments, okay, repetitively, over and over and over again, like you would to the gym, because we're going to change how that memory is. So let's take a look and see how the positioning is. There's your belly button, right?
Yes.
Okay, look at now, if I was to draw a line straight down. Can you see how that's lined up? You see how this is lined up with this one? Okay? Now when I turn facing me, when I touch her pelvis, my hands are perfectly even like this. Okay, so now the rotation is completely out. So these are some of the things that we do when we're working with sciatica. You have to check all 3 dimensions. You can't just go to a chiropractor just kind of doing one dimension, putting you on your side, adjusting each side. These dimensions of the rotation, the translation are absolutely crucial. So I hope if you're a chiropractor, you're able to learn some of these things. And if you're a patient, ask your chiropractor if they're doing this type of 3-dimensional work. And thanks for joining us again on the chiropractic approach to sciatica.